Good morning everyone and welcome to our channel Gate Hospital. Today we are sitting with renowned laparoscopic surgeon Dr. Uttam Choudhury, who is also the medical director of Gate Guwahati. Hello doctor, welcome to our channel.
Welcome.
Doctor, would like to ask you a couple of questions regarding this hospital. So what does Gate stand for?
Actually, GATE stands for basically Guwahati Accident Trauma Emergency Hospital. So it was set up with a vision that will provide the best emergency services in the golden hours of the needs of the patients. That is, suppose a patient comes with one accident patient comes to our hospital, we'll try to provide the best services within the first 6 hours. If suppose any brain operation is required, or say any orthopedic intervention is required, our aim is to provide the service in the first 6 hours. That is, and we have around the clock 24 hours super specialty services, like we have the round the clock neurosurgeons working out here, orthopedic surgeons, CTVS surgeons, and I'm the general trauma laparoscopic surgeon doing all the abdominal trauma surgeries here.
Great. So what type of laparoscopic surgery? I've heard a lot about the daycare laparoscopy, right? So I would like to know more, what does daycare laparoscopy stands for and what type of services actually we are providing?
See, this nowadays the time has changed actually.
Right.
So we are opting for daycare laparoscopy in our institute nowadays.
Right.
Now there are many advantages of the daycare laparoscopy. Like the first is that the pain is very less, the stay is very less, only single day. Then patient has comfortable to be at home the next in the evening. So that is a psychological booster for the patients also, because you see a lot of patients comes in our hospital. If we allow them to stay for around 2 to 3 nights, they don't feel like staying it. So that is another point. Plus it is also cost effective also, because see the stay is also, if the stay is more, then the cost will be also more. But in daycare laparoscopy we do packages around 40,000. So including investigations and medicines, around 40,000. So it's cost effective for the patient also, and the most important is that they can go to home the same day, and that is a good it's a big psychological advantage for the patient actually.
Okay.
And the pain and what about? But there are certain criteria. We cannot do all the laparoscopic surgeries in a daycare manner. We have to select certain cases for that. Suppose it should be, if we are going for a gallbladder surgery,
right,
it has to be like a uncomplicated gallbladder case. So then only we can go for a daycare laparoscopy. We can discharge the patient on the same day, on the date of the admission. And daycare urology surgeries are going on in our hospital, so that is also a very good scope. And daycare ENT surgeries that are also being performed in our hospital.
Okay, great. So I think the success rate for daycare surgery is much more higher.
Definitely 100%. It's almost 99% success rate.
And we do surgery for gallbladder stone and kidney stones, right?
Gallbladder, kidney, then ENT laparoscopy.
And apart from daycare surgery, what all surgeries that we perform?
Like apart from daycare, we do normal laparoscopic surgeries. Usually the laparoscopic gallbladder packages that are around say for general bed it is around 30,000. For for general cabin it is around 35, and for deluxe it is about 40,000.
That's quite affordable. And are we also accepting some?
But there are some terms and conditions in that here. Like the duration of the stay is for 2 nights, and that is inclusive of that is exclusive of the medicines.
Okay.
Okay.
And are we accepting any kind of like health insurance or something like cashless benefit?
Yeah, nowadays we are availing our cashless benefits from the insurance companies. So those companies which are tied up with us, we are doing those patients regularly nowadays.
Okay, that's really beneficial actually for people to know.
Yeah.
And the daycare surgery and the laparoscopic surgery packages that you're offering is also very economical, and I guess it's based on targeting those lower income group people.
Yeah, I think that is, if you compare things, we are mainly targeting the lower economic strata group only. So I think it is quite affordable for them.
Great. Apart from that, doctor, I would also like to know, like other services. Like we do have a burn unit.
Yeah. See, apart from this is what about I'm saying about the daycare laparoscopic surgery. Then we have a very good urology team that is led by Dr. Debanga Sharma, and he is doing regular all procedures of laparoscopic urological surgeries. And including we have got laser prostatectomy, laser lithotripsy, almost every modernized urological procedures are being performed in our hospital. So that is urology. Orthopedics, we are doing very nice things like we are going for joint replacement also. So orthopedics, that is now. Then if you consider the ENT surgeries, we are doing regular daycare ENT surgeries and the neurosurgery. So that's like neurosurgery, it's a part and parcel of our trauma care department actually. So we are doing regular neurosurgical operations like craniotomy, spine surgeries, everything.
Would you like to share any success story that recently, you have recovered a patient who performed any one of the surgeries and they have really done well?
Yeah, there was a patient named Indrajit Nath actually, who was admitted around 2 months back in our hospital in a very bad shape. So when he came into our hospital, he was having polytrauma, we call it polytrauma, multiple injuries.
Okay.
He had a degloving injury of the scalp, then he had a fractured mandible, he had blunt abdominal trauma with splenic injury with hemoperitoneume, the blood in the abdominal cavity, plus there was chest injury. So we dealt the patient very nicely actually, and to our surprise, we discharged the patient in around 10 days only. We did around 4 surgeries for that patient. We did the abdominal laparotomy, we did the mandible fixation, we did the clavicle also. There was an orthopedic part also there. So clavicle fracture. So ultimately I think there were around 4 surgeries, and the patient recovered very well, and the party was very satisfied because the party never thought that the patient would survive when they come. But we always believe that we can do it, because that is our motto. And my motto is that we have a very good to give the maximum in the first 6 hours.
Right.
So, and we have a very good trauma response team also, which is led by our critical care, along with the critical care unit, that is led by Dr. Rishikesh Hazarika. So he's a very good intensivist. And myself, I'm doing all the trauma surgeries, and pass our MD, the CMD sir, that is Dr. Vedabrata Pathak. He is the chairman, managing director. He's an excellent laparoscopic surgeon actually. So he has done almost around not less than 50,000 gallbladder surgeries. So we have got a very good surgical backup team.
That's really brilliant, doctor, and I really appreciate the kind of work that Gate Hospital has been performing, and so many success stories, so many patients that have gone really well, by getting treated over here. So I would really recommend if anybody is having any problem related to the surgery, you can just come over to Gate, or you can just inquire about those packages, those surgeries by Dr. Uttam Choudhury, and he is available. So thank you so much, doctor. I think that's it, and hope you have a great day and wish you all the best.
Thank you.
Thank you.
Uncle.